Some African countries have introduced herbs that were touted as effective against COVID-19, but many of them have fallen flat. Now Zimbabweans and talking up another herb they say have been effective against the coronavirus in their villages. Some health professionals agree, but many reject the claim.
32-year-old Zimbabwean Precious Magwere is a fan of traditional medicine. In these tiny leaves, thriving in her backyard, she finds solutions for common colds and infections. But after a COVID-19 diagnosis a few months ago, she has found other uses for the herb. Now she praises the remedy for helping her to recover from the disease.
My grandmother used to give us this plant to fight dry coughs when we were young. So I grew up knowing that any cough can be treated using these herbs, and I decided to fight COVID using the same plant, steaming as well as drinking the concoction.
While her son may not be too convinced, Precious swears by it, and so do many people of her generation.
Naturally, we use Zumbani.
In Zimbabwe, we have the Lipia javanica plant, which is very popular in treating colds and coughs. I am a testimony of its effectiveness because I was down with flu for nearly 2 weeks, and after using the plant, I am back to life now. So many people in this area are getting infected, but they fight the disease using this plant.
But with the use of Zumbani,
the government of Zimbabwe in April of 2020 had authorized herbalists to treat coronavirus patients. However, medical experts were opposed to the idea, saying it's not clinically proven. However, some nature enthusiasts are supportive of the government's directive.
It is evidence-based medicine. You may say, oh, in Western medicine, you need a double-blind, placebo-based type of clinical trial. Yes, that's okay. But those double-blind and placebos have already been done over centuries and centuries, that this information has been passed down the line. Over generations and generations, this medicine has been tested and tried for groups of diseases.
The Africa Centers for Disease Control and Prevention reports Zimbabwe has slightly over 30,000 cases and close to 1,000 deaths. The country had been enjoying relatively low numbers in previous months. However, they doubled in December following the festive season travels. The rising cases prompted the government to impose tougher measures, including a national lockdown for 30 days and closure of land borders. The South African country is yet to roll out a vaccination program for COVID-19. In the meantime, traditional medicine will remain popular among the citizens.